splints. What are shin splints? Glad you asked. So your shin bone is also called the tibia, which is the bone between the knee and your ankle. And many times you get pain, especially athletes. You get medial tibial stress syndrome. That's one of the names they call it, MTSS, or anterior tibial stress syndrome. And what is that? Well, it's caused by stress on the tibial bone. So the periosteum, which is the kind of membrane on the bone, gets kind of tugged. And why do you get that? Well, if you're ever in Jamaica during, is it January, February, when we have something called Boys and Girls Championships? It's our high school track and field event. Very intense. That is where we get most of our athletes from. And so runners tend to get it. But runners are not the only ones who get it. People who, just start running initially, you'll get pain medially or laterally, like in the anterior area. If you increase your intensity, frequency without rest or duration, what do I mean by that? If you start running more than you usually run, instead of every other day, every day, or instead of once a day, twice per day, or if you start running longer distance or running really faster than you used to, that can cause tibial stress syndrome, whether medial or anterior. In addition to that, it might be uneven surface where you're running on a hill, on a ragged, rocky road, or if you're running on concrete, or in the military. People in the military get it as well. And so today we're going to talk about what do you do if you have it. Some of our athletes have it all the time. As a sports medicine doctor, I see it all the time. So medial tibial stress syndrome, usually caused by the tibialis posterior muscle, which starts here distally, meaning on the further part of the leg, and it goes down just medial to the ankle, and it inserts in your foot bottom, and that muscle will help you to point your toes down and kind of invert, whereas the tibialis anterior, tibialis is this fat muscle here, which helps you to dorsiflex, which is bring your toes up. It helps you to walk on your heels, whereas the tibialis posterior will help the gastroc, which are the calf muscles, to walk on your toes. So now, what do you do to prevent and to treat? Usually in sports medicine, one way of preventing is to make sure you're stretching and make sure you're strong, so you can endure the stressors. So let's start with some stretches. Now we're going to stretch the calf muscle. So tight calf can also lead to medial tibial stress syndrome, and tight tibialis anterior can lead to the anterior tibial stress syndrome. So we're going to use a stretch strap to stretch the calf. So you stuck your toes in, and so you're going to pull, right? You sit up straight and you pull towards you. So you pull dorsiflexing, so you're stretching your calf, and your calf will have two muscles, your gastrocnemius and your soleus. But it also will do a little bit of stretching of the tibialis posterior. So whatever you do on the left, you do on the right. So your dorsiflex, you pull and you count to about 30. For me, I kind of add a little bit of stretch to the tibialis posterior, so I kind of invert. Since the tibialis posterior will invert when it's too tight, I'll invert and stretch it out a little bit, so that will give you that extra stretch, right? If you don't have a stretch strap, you can go to your local hardware and buy a rope. I think the last time I called it a cord, but it's really a rope. So get a nice thick rope, not the thin ones, and you can put a knot at the end like here. This one is a little long, so let's turn it this way. So you put a knot at the end and you can pull. So you don't have to just buy a nice rope you can pull. So that's to stretch your calves. I'm going to show you how to stretch the calves some more on the ground. Now, another way to stretch, we have to stretch out the muscle in the front, the tibialis anterior. So the tibialis anterior is this muscle here, this one here. So how do you stretch that? Glad you asked again. So we're going to kneel, go down on our knees with your toes down, and you're leaning back. So that's stretching the tibialis anterior. That's a way of stretching your tibia. Call it tibialis anterior. So you stretch your tibialis anterior. You can also stretch it another way, where if you have someone who's helping you, and they can actually pull the toes down. So that will stretch it. But really and truly, you should have your knees straight when you're stretching, right? So that is for stretching out the tibialis anterior, stretching out the gastrocnemius. Now what we're going to do now, we are going to stretch it on the ground. Now we're going to stretch the gastrocs. So you put your toes against the wall. Imagine that this is a wall, and bring your knee to the wall and keep them both against the wall. And then as far as you can go back, with your heel still on the ground, you feel a nice stretch of your gastrosoleus complex. So you can even push back further and you feel the stretch going down, right? You do that and you count to 30. You do the same thing on the other side, knee and toes against the wall and slide back. So my right foot is my gastrocs on my right is a little bit more flexible, so I can actually go much further on my right. And this is as far as I can go on the left, right? That's for your gastrocs. And I can stretch the soleus, which is different from the gastrocs because the gastrocs crosses the knee joint and the ankle joint. So you have to keep the knee straight to stretch the gastrocs. But to stretch the soleus, all you have to do is just bend the knee, and that's stretching the soleus. See, that's how you stretch the soleus. Do it on the right. You do it on the left. Count to 30. We're going to strengthen the gastrocs muscle, gastrocnemius muscle, which are the calf muscles. So there are two ways to do it. You can either do it in an eccentric way or a concentric way. What does that mean? Glad you asked. So eccentric is where you strengthen and lengthen at the same time. It requires more power and it gives the muscle more length, less likely to tear. And concentric is where you shorten the muscle while contracting. So if you're doing a biceps curl, you do that, that's concentric. Or if you're going against resistance, that's eccentric. So we like to do eccentric in the calf. Why? Because if we do concentric, which is toe raise, which I'll show you after, you can strengthen the calf muscle, but you shorten it, and that will make it tight. So we're going to go on a step, a very safe step. You can tape books together, make sure it's very sturdy, or you can use a step at home, and you go up with 2 and down slowly with 1. Up with 2 and down slowly with 1. That will strengthen the calf muscles. Up with 2 and down slowly with 1. On the other side again, up with 2 and down slowly with 1. Excellent. The opposite to that is to heel raise, calf raises, but that will strengthen your gastrocs, but it will shorten it. So we do the eccentric instead of the concentric. We're going to strengthen the tibialis anterior. Remember, the tibialis anterior is one of those muscles that can cause anterior tibial shin splints. So you get a elastic resistant band, and you can tie it on a bed if you're alone, or you can have somebody just hold it in front of you, and you pull as far as you can away from it, and you dorsiflex against the band. So then you come somewhere so I get a little bit more resistance. Dorsiflex, which is bring your toes up against the resistance. Again, whatever you do on one leg, you have to do on the other. So let's switch it over to my right leg. Same thing. See that? My right leg is much stronger than my left. Dorsiflex against resistance. Dorsiflex against resistance. That's it, guys, for shin splints. Remember, medial tibial shin splints, anterior tibial shin splints. Medial is usually distal, closer to the bottom, closer to the ankle. Tibial is posterior muscle, and anterior tibial shin splint, tibialis anterior muscle. Keep them stretched, both of them. Keep them strong and long. Blessings.